I just wanted to welcome everybody, and we're going to have an outstanding presentation here by Dr. Gruner. I wanted to remind you that we are recording here this evening, and right now everybody's muted. When we come to Q&A or chat, you're welcome to raise your hand. You can unmute yourself, or I can read your chat in the chat function. So welcome. And the presentation here tonight is entitled The Latest in Mobility for All. Just a quick introduction for Dr. Gruner and a few of the highlights. If I gave full justice to his career, we'd be past the end of the presentation, Dr. Gruner. So I'm going to just do the highlights here from your website. He has a DO, an MBA, and an RMSK certificate. He's a practicing sports medicine doctor in Bethesda. And right now he is serving as staff at Point Performance. He attended Virginia Tech for his joint medical and business degrees and completed his residency in physical medicine and rehab at the Georgetown University and National Rehabilitation Hospital in DC. He finished his sports fellowship at Mayo, which is just outstanding. And he specializes in the prevention and treatment of sports injuries and minimally invasive procedures. I know many of us during this pandemic have not been as active physically as we would like to be, perhaps. So Dr. Gruner can give us some good advice about keeping active, keeping moving, and what the latest is in this space. I can also tell you from personal experience that right before I was ready to come down to the beach, I was having some back problems, and I saw Dr. Gruner on pretty short notice. I appreciate his seeing me. And I can tell you I'm having a good experience about my bad back. So thank you very much for helping me. And the floor is yours, however you would like to use it now, Dr. Gruner, and then we'll do some Q&A and some chat questions with you in a little bit.
Okay, well, thank you so much, Carol. I really appreciate it. Can someone let me share my screen?
Farnita, can you do that for us?
I sure can. I'm doing it now, Dr. Gruner. 1 second.
Thank you. Thank you. Can everyone see my screen? Hopefully they can. Carol, can you see it?
Yes, I can.
Perfect.
Yes, I can. Thank you.
So, I look forward to talking to you guys today. I grew up in the DC area. I was born at Sibley Hospital, and I'm really happy to be practicing sports medicine in my hometown of the DC area. Today, we'll talk about diagnostic and treatment options for non-surgical orthopedic conditions. I do have a disclosure. I have a digital health company that I started called Limber Health, but no conflicts of interest today. Carol gave a great introduction about who I am. And so I was born and raised in Bethesda, Maryland. And she talked about a lot of my background, graduating from my sports medicine fellowship at Mayo Clinic, which we'll talk about in a little bit. But I do have this special certification in diagnostic ultrasound. And so it's really important that if patients need have a shoulder injury or have an elbow injury or a wrist injury, I could actually save a lot of patients an unnecessary MRI by diagnosing them in the office of a soft tissue injury like a rotator cuff tear. One of the things that I learned at Mayo Clinic, which was really important, was, how can we deliver the best care to taking care of a patient? And this is one of the centers that we worked at, was a one-stop shop healthy living center. And they had yoga, Tai Chi, massage, physical therapy, surgery, swimming pools, cooking. How can we embody taking care of patients in a more holistic way and providing a one-stop shop for their care? And that's what we've really been working on at Point Performance. We don't have the surgical care, but even though I do some surgeries, but we do a lot of non-surgical care, and we take care of patients with all different types of orthopedic injuries, really spanning the entire scope of practice. and we have physical therapy, massage, nutrition. We really believe in a holistic approach to taking care of a patient, making them feel better. So today we're going to talk about the evidence of some non-operative care, which I think is really important to talk about. And then we'll go into some procedures that I do that I think are very innovative and minimally invasive. And then we'll talk about some regenerative medicine that I do and what's the evidence behind that, and then diagnostic ultrasound. So the first thing that I was going to talk about is, which is really important, is just explaining to the public, and I had a talk at Sibley Hospital about, just what is the evidence on musculoskeletal medicine? Well, the British Journal of Sports Medicine came up with a systematic review, and they came up with 11 consistent recommendations about how to better manage musculoskeletal injuries. What I learned when I was at Mayo Clinic was that what people were doing there was not what was happening in my hometown of the DC area. And so I think it's really important just to start the conversation with going over some of these key recommendations. They said the number one, which I think is really important, that for low back imaging, it is really important not to get an image as the first step in care. Therapy, if there's no red flags, therapy is the benefit, is the most important thing that you could be doing. The second recommendation was that ultrasound should be used as the first line for looking at rotator cuff injuries before you ever get an MRI. And so these two recommendations were really important for imaging, and they're not practiced as much in the DC area as I would like. The third one was that there was a huge overuse of surgery for knee arthritis. So while hip replacements can be really great for patients, and knee replacements, it works for most patients. 30% of people are unhappy with a knee replacement in the US. Getting your knee scoped for a meniscus tear after the age of, I would say, 45, unless you have a meniscus tear that is obstructing the meniscus, should not be done. And it's highly not recommended at this point. And this has been shown in many different studies. That goes with a couple other surgeries for rotator cuff repair. Even full tears in the shoulder should not be repaired and has been compared to sham surgery. The other recommendations was there was too many opioids prescribed, which you guys might be familiar with on the news. And then the last piece, which I think is really important, is that there was a failure to provide education and advice to patients on orthopedic injuries. It's really important to empower the patient to understand what their condition is and educate them on what options lie for them, whether it's surgery or non-surgery, and educating them about their condition. And that's not happening at the initial step of care in the United States as well as it like. So with that, I'm gonna just go into some of the newer things that I do and what treatment options I can offer for patients. The first one is called tendon scraping. It's for Achilles tendonitis and patella tendonitis. So it's either on the front of your kneecap or behind your heel. And it's a way for us to free up the tendon. So here's the kneecap, and then here's the tendon. And you'll see that we can see under ultrasound, there's inflammation that's happening between the two. And we can free up the tissue under ultrasound guidance. So for a lot of tendonitis, it really helps improving pain and function without ever needing a surgery, without ever going into the tendon. And it can be a very nice treatment option for some chronic tendonitis for patients. In addition to that, I really believe that every single time you consider a procedure, you should do a rehab program, and it has to be a progressive rehab program. So we took Mayo Clinic and Emory's rehab programs, and we've combined them into a progressive rehab program when we do any type of procedure. And that's how care should be done. You should have a more holistic plan, not just the procedure, but the entire care plan should be thought out, and it should include a progressive rehabilitation program. The next treatment I'm going to talk to you about was invented at Mayo Clinic, and it was something I had on my body for patella tendonitis, and it's also something for tennis elbow. So what happens in your elbow or golfer's elbow, Achilles tendonitis behind your heel, plantar fasciitis on the bottom of your foot, or something called calcific rotator cuff tendonitis. And what it is, I'll just go, I'll show you guys in a second what it is, but it has really good clinical outcomes. In fact, over 90% of people will be a responder to this treatment. And we talked about the different conditions, but what it is that we see under ultrasound, there's some inflammation in the tendon, and the tendon's diseased for some reason. And what we can do is under ultrasound, was invented by my fellowship director at Mayo, who worked with an ophthalmologist who did cataract surgery, was we can go to the area that's injured for the tendon, and we can remove the damaged tissue while preserving the normal tendon. And so it really allows for quicker recovery. They don't need to get surgery. And also it has been shown to be very effective in improving patients' pain, function, and quality of life for different tendon problems. And so a lot of patients come to me and the first question is say, hey doc, what is the evidence for this? In fact, about 40% of my practice is physicians from NIH and around the area. And I'll always give them studies on what I do, because I think that's what evidence-based medicine is. You shouldn't just take one or two samples of something. You should take a systematic review of a lot of things. And so this is a good study showing long-term treatment options for tennis elbow, that condition along the elbow. And it showed 3-year follow-up of pain and function. And it showed now there's 7-year studies showing 7-year follow-up. So these are patients that had pain in their elbow, wasn't getting better, and showed that Tenex improved their condition at 3 years and in 7 years. And in addition to looking at their pain and function, we were able to look under ultrasound, and you could see here this black area is the tear, and the tear filling in, and it correlated with their pain and function improvement. So it was kind of a really good study, and there's been many studies that have been looking at this treatment option for patients with chronic tendonitis. It doesn't get better with rehabilitation. And this was another study. We'll talk about PRP done at Emory University, showing great treatment options for tennis elbow. And a lot of times, sometimes people will say, well, does that mean I can't get the surgery? No, you still can be a candidate for the surgery. It doesn't ruin the treatment. And this was a study that showed that it was equal and effective to the surgery. So they took one group that had the surgery, and the other group that had Tenex, this minimally invasive procedure, and showed quicker recovery and similar outcomes to the surgery. The next treatment I'll talk about for a non-surgical treatment option for the shoulder is called calcific lavage. So sometimes patients, usually happens to women in their 40s and 50s, they'll get some pain in their shoulders, and it'll be due to these calcifications that happen in their rotator cuff. And so we use a special needle, and it can actually take the calcification out of the area, allowing them not to impinge so they can go back to yoga and enjoying their life. And it's been really effective to do it because it's minimally invasive, so it's a shorter rehabilitation program. And this is kind of what it looks like under ultrasound. We're able to take the calcification out while preserving the normal tissue. The next one I'll talk to you about is a condition called carpal tunnel syndrome. This is a condition that has patients will have pain, numbness, and tingling, sometimes a weakness in their hand. Opening up jars might be difficult, and it'll usually happen to their first 3 fingers. Sometimes we'll recommend therapy. Sometimes we'll recommend braces. They'll be worn at night. But if that doesn't get better and injections don't help, I offer a ultrasound guided surgery for carpal tunnel syndrome. And so the normal way of doing carpal tunnel surgery would be making a huge incision in your hand, and sometimes there'd be complications with that. Well, now there's a new device that was invented at Mayo Clinic that we're able to cut the ligament under ultrasound while preserving the rest of the tissue. And the incision's in the wrist, so they don't have any incision in their hand, and people can go back to their daily activities within a few days. The other thing that's really important is it's very safe. So what we do under ultrasound guidance is we can see where the nerve is and the artery is, and then we will use this device and go to the end of the ligament. And then what we'll do is we'll use a balloon and we'll actually spread the balloon out and to make sure there's a safe area. And then we can cut the ligament under ultrasound guidance. And it's been shown to be very, very effective. This was a study done at Jefferson Hospital and another one published in the Journal of Hand Surgery showing long-term clinical outcomes of this ultrasound guided procedure, and it's covered by insurance. The next one is for trigger fingers. So sometimes patients will have pain, they might have locking in their fingers, and it will be caused by a pulley that gets thickened right where their finger is. And sometimes it'll catch on them. And so this is a treatment option that we will do for patients who have triggering or they'll have pain at their finger. And so we'll use a special needle and we'll actually open up that area, removing the restrictions so they don't have any trigger fingers. So it's actually the entire surgery can be done under ultrasound guidance with a small needle in the office, no general anesthesia, similar to the carpal tunnel surgery. And this is what it looks like. We'll use a special needle and we'll go adjacent to the tendon and actually get rid of the trigger finger while preserving the rest of the normal tendon. The next one is one of my favorite procedures that I offer for patients, and is for frozen shoulder. This happens to a lot of patients who, for whatever reason, sometimes diabetes, sometimes thyroid disease, their shoulder will be frozen and they can't move it. And also happens to patients who are recovering from some breast cancer and are having pain in their shoulder. And so this is a procedure where I'll actually put fluid in the shoulder to free up the capsule to allow more motion. So a lot of times people who can't even touch their bra or tie their bra are able to do this after the procedure. And this is what it kind of looks like. This is a patient that—
Let's talk about one treatment option for frozen shoulder. This injection is a solution of saline, lidocaine, and steroid, which goes directly into the shoulder joint under ultrasound guidance, breaking up adhesions and expanding the joint capsule. This patient has been doing physical therapy, but was seeing limited improvement. Immediately following the injection, you can see the difference in her range of motion. The patient received immediate relief after the procedure.
Wow, that's pretty amazing, actually.
This technique is used in conjunction with physical therapy as part of our integrated medical practice. Call us today.
So those are just some of the newer procedures that can be done that are minimally invasive. And if rehabilitation is not successful, these are treatments that can be done before trying surgery. The next thing that we're going to talk about is one of the most interesting things that I think I offer. And what I want to go over is the evidence behind them today. And we'll talk about that for hip and knee arthritis. And really it's for any arthritis, but we'll really focus on hip and knee arthritis. Well, we know that hip and knee arthritis affects 1 in 2 Americans in the United States every year. And it can really be debilitating for patients. And we know hip replacements do very well, but there's a threshold where you might not want to get a hip replacement if you're still very active, but are looking for other treatment options before getting the total hip replacement. For knee replacements, 30% of Americans are unhappy with a knee replacement in the US. And I'll show you an article about that. And so we're looking for newer options to help prevent a knee replacement and hip replacement so patients can get it at the opportune time. So this was a study that was done, this was a paper that was published in the Washington Post showing that 1 out of 3 patients are unhappy with a knee replacement. And so we're really trying to refine who is the right person for a knee replacement. In fact, this other study showed that 20% of people are really unhappy with the knee replacement. So not only that we're 1/3 might not be the right candidate, but 20% of the population is really unhappy with it. And that happens to be it being offered too early or not at the right time based off their functional levels. So people at Harvard and Stanford are doing machine learning studies to try to refine and find who are the right patient populations for this, but we're still having difficulty for this. So now we're looking at treatment options for regenerative medicine, so looking at what are the best treatment options that can prolong someone from getting a knee replacement or a hip replacement. And the two I'll talk about today is PRP and autologous stem cells. And I think in this area, people are using this all the time for everything. And what I'll go over is the evidence and how it has good scope, and we'll go over what terminology should be used with patients. Additionally, I want to talk about something that's really important, is that regenerative medicine is considered an accredited specialty now at Mayo Clinic. And it has a lot of evidence, and we'll go over what the evidence lies for some of these treatment options. So the first one we'll talk about is PRP. So people are using PRP for everything, baldness, facials, and it can really help a lot with patients for arthritis. And so what is PRP? PRP is where we take your blood, we spin it down, and we get platelets. Those platelets have growth factors, and those growth factors help with healing. We know that when we get those platelets, which you see here, those platelets can really help long-term, a lot more than like a steroid injection could, into joints, and can be curative for tendinitis. And so it's being used for chronic tendinitis, arthritis, muscle injuries, and ligament injuries. And so what is the science behind this? Well, we know that for arthritis, there's some type of inflammation that happens in the joint. And what happens is that leads to cartilage breakdown. Well, PRP adds growth factors to the joint that stimulate long-term healing. The other thing that we know from when I was at Mayo Clinic, is that it's very safe. It's been looked at long-term studies, and it's safer than steroid, which there's been some studies showing that steroids might not be the best first option for most patients. But once again, what is the evidence? What do we know about it? Well, for knee arthritis, which has been the most studied out of any of the joints, it has been well studied, and the level of evidence has been very, very high. In fact, these are two systematic reviews. So they looked at the best studies in science, and they made sure they looked at randomized control trials. That means that there was a placebo and a control group was done, and they showed that PRP was more effective at a year than gel injections and other types of treatment options. And this was a study done at University of Colorado, showing PRP to be superior to hyaluronic acid and other treatment options for knee arthritis. And a lot of patients, well, does this prevent a knee replacement? Well, this was a study of 1,000 patients, and showed that 75% of people were able to delay their knee replacement by several years. In fact, 85% didn't need a knee replacement at a 5-year follow-up study. And this is a study that was published in the Journal of Medicine in Baltimore, Maryland, that showed it was the first systematic review of double-blind randomized control studies. So the bias was very low because they were able to blind both treatment arms, and showed really good improvement in pain and function for knee arthritis. And so now there's being more studies about cost effectiveness of PRP over other treatment options. And I think although it doesn't grow cartilage, it really can help improve pain, function, and quality of life for some patients. The next thing I'm going to talk about is tendinitis. And we talked about Tenex for the elbow, but today I want to talk about PRP for tendinitis. And so this was a study done at Stanford that was one of the first studies that showed PRP being effective for tennis elbow. And now there's been other studies showing PRP being effective for glute tendinitis or trochanter bursitis on the side of the hip, and also for medial epicondylitis, comparing it to surgery. And so there's been some good review studies looking at all the evidence for tendons. And I would say some areas it works really well and some not. So we're trying to refine and really find out who are the perfect candidates for this. And this is why collecting patient-reported outcome measures is really important. And it's one of the things that we practice at Point Performance. So we talked about PRP for arthritis being very helpful. And typically it can last a year. For tendonitis, it can be long-term and curative, but more studies are needed depending on the body part affected. So the next one we're going to talk about is stem cells. And there's stem cells have been used in the news for treating cancers and all different types of tissues. And the way it works is that it differentiates into appropriate cell types, replacing the degenerative tissue, preventing degradation. And there's two locations you can get stem cells. One is from your fat and the other one's from bone marrow. And although this is, I think, still experimental, there's been some really good evidence, and we're doing 2 studies at Point Performance right now on adipose stem cells. One is done at Cornell University through Point Performance, another one's at University of Colorado. And we're looking at stem cells for knee arthritis. And right now we can get a discount for patients if they want to be part of the study. And it's an adipose stem cell study. And these are some of the studies that have shown really good long-term outcomes, improving pain function for knee arthritis. And it looked at, this was a study, this top one was done at Rothman Hospital in Philadelphia, and another 3-year follow-up study was showing really good clinical results. I think it's still early, but it's showing more promising results than PRP. And this was exciting because it was the first study done out at Emory University that showed 2-year follow-up of patients over the age of 60 and showed really good outcomes of improvement in their pain and function. And so now there's been a few more studies, but we really need more evidence to really make sure patients are getting the right procedure and make sure that there's evidence that supports them. So it's still preliminary, but very exciting opportunity within the field of non-surgical orthopedics. The next thing I'm going to talk to you about, anytime someone does a regenerative medicine procedure, it's important to get a rehab program. And we always give comprehensive rehab programs that go with their procedure. And so really providing a holistic step of care for them. The next thing I'm going to talk about is diagnostic ultrasound. So ultrasound is great at looking at babies. In fact, my wife is pregnant and I love looking at ultrasounds of our new baby girl that's coming on the way. But it also could be used to look at different injuries in shoulders, elbows, hip, knees, and there's really good evidence about this. And what's nice is it can save a lot of patients an unnecessary MRI. And so this is what a normal rotator cuff looks like. And this is what a normal biceps tendon looks like. And so we can actually see if there's a tear in that rotator cuff and save that patient unnecessary surgery, unnecessary MRI, and sometimes an unnecessary surgery if there is no problem there. And it's been shown to be very accurate compared to MRI. It also helps us to do injections under ultrasound and also take out cysts in the knee or in different areas. So we can actually remove different cysts under ultrasound guidance. And so a lot of people ask me, well, I went to my surgeon, he did this palpated guided injection and injected me. It was really painful, but was he accurate? And this was a study showing ultrasound guidance injections versus blind injections, meaning that they don't use ultrasound to make sure they're in the right location. And so this study looked at all the different joints in the body and showed that ultrasound, for the most part, was more accurate and more effective than blind injections, meaning when someone just put their finger where they think a structure is and then inject it, we saw that ultrasound was more accurate and more effective. What's really important was this study. This study was a 1,000-person study. They took 500 people getting ultrasound-guided gel injection, which is one of the treatment options for knee arthritis. and 500 had a blind knee injection. And then they followed these patients for 12 years at Mayo Clinic. And they showed that ultrasound-guided injections prevented someone from a knee replacement for 3 years longer than someone who had a blind injection. So this study really was a huge landmark study for how Mayo did injections and made sure that they were all ultrasound-guided injections. So I practice at Point Performance. It's on Mass Ave in Goldsboro. This is some of my contact information, and I really appreciate talking with you guys. Our practice is a one-stop shop place really focused on healing, and I appreciate, I'm happy to answer any questions you might have.